First of all, I will very briefly introduce what we have done with the basic research and clinical epidemiology research here in Taiwan. The conclusion should be that we have identified, although as everybody here is aware that CLL is much less prevalent in Asia, including in Taiwan, but actually in the passing maybe 20 years, the incidence rate is going up continuously. So I think this disease will become more and more important here in this region. On the other hand, we also identify some, let's say, molecular epidemiology patterns, characteristics that occurs in Taiwan that is different from that in the Caucasians or in the US or the EU. And in terms of that, we majorly identify that we have much less, let's say, major stereotypes CLL patients in our population. I believe that this finding will point out the pathogenesis of CLL, especially in terms of the different epidemiology between the two populations. But in addition to this, my major focus will discuss the clinical practice in Taiwan. Because of the small patient population as well as the differences in medical care systems, there are quite some differences between the clinical practice to deal with CLL patients here in this region. I will briefly introduce what we are doing, what the major gap we have had here in this region.